Okay, terrific. Got it. Okay, so we're going to be talking today about some initiatives that are going forward to keep our program relevant and to go into the future. But I'm also going to start with a bit of a background to the program, since some of us, more, have been here since the very beginning of the program. Okay. So apparently we're starting with a Slido link, and could you please explain?
Sure, I'd be happy to. Just as a reminder, we rehearsed this significantly many times. It's going to be seamless transition between Karen and I today. So just to say, there's going to be a number of interactive questions throughout. We're using Slido. We're not actually doing multiple choice. We're going to be doing short answer and other forms of questions throughout this if you actually want to hear from you in terms of some of the things that we're talking about. So you go to slido.com, you can see that www.slido.com, and then punch in the 6-digit code that will queue it up, and then when we get to our first questions, it will just operate seamlessly, integrated with the PowerPoint presentation, or so Slido tells me.
Of course. Okay. Okay, well, I'm going to start with a trip, shall we say, down memory lane. And in 1990, there was a special initiative that UBC was able to take advantage of, where we got a $3 million endowment from Workers' Compensation Board, which was then matched by the government of British Columbia to endow the first of the faculty members and to initiate this brand new program, which at that point was called occupational hygiene. And it was one of the only graduate programs in Canada and the only one in Western Canada in occupational hygiene. So the whole purpose of the endowment was to be able to bring the level of expertise, both in research and in practice, into the province, and by being able to train our next generation of hygienists was the whole purpose of the grant. So in 1992, we have been on the 3rd floor for the entire length of the program. We started on the 3rd floor of the SPPH building in 1992 with 13 students who were part of that first cohort. Now, if you carefully examine this black and white photo that's in front of you, you may or may not recognize some faces that look a whole bunch different back then than they do now. But then through through chemistry, some of us don't look as different. But this group was both the very first the 1992 and the 1993 cohorts, and most of the folks, with a few exceptions, are now all in senior leadership positions across Canada and even into the United States. Some of the folks here are senior in WorkSafeBC, some of them are in major corporations, and some of us are still here. So we had in 1992 then a big rollout of the program. It was all very exciting. And I want to point out some luminaries on these photos here. So Dr. David Swainway was the president at that point of UBC. So obviously it was a big deal to have the opening ceremony. But standing next to him is Dr. Susan Kennedy. And she, as well as you'll see photos of Keith in a bit, She and Kay and Chris Van Metten were all part of what was then called healthcare epidemiology, but participated in research that had to do with health of workers so they had been pursuing this as their own research agenda and were then in the perfect position to be able to start the program as the first faculty in the program. So standing next to, the plaque, which any of you that come up to the third floor, that plaque is still on the wall at this point. And standing next to that is Lydia Ma, who, if you haven't met her yet, you will. She's been very much part of the program, even though she's with the National Center for Environmental Health. And then we also had Dr. John Grace, or Dean John Grace, in this next photo that is taken, of course, in our own lab upstairs on the third floor. And those were the primary folks that were, and then of course there were folks there from WorkSafe BC and other luminaries for that. So from the beginning, we started with the research of a very research focus because it is a graduate degree. There are lots of other programs out there. For example, BCIT has a undergrad in environmental health, and across many colleges, there's still colleges back in the 90s, had health and safety types of programs. They were all at the undergraduate level. There were very few graduate programs in this field, and so that made us stand out. But we needed to have a platform to put that first program together. And that platform was very much part of a broader initiative. So for example, in the United States, NIOSH had what were called educational resource centers. And who we regard as a sister institution, University of Washington, we were able to take the framework of those existing programs and also make a unique program for ourselves here in Canada that was very Canadian focused and not just to take the materials that were developed through the ERCs and NIOSH. Now, as well, we founded the program on what's called core competencies. And there's an international organization called the American Industrial Hygiene Association. They are very much part of the practice of industrial hygiene in the States, occupational hygiene here. And that became initiative of putting together the program. And there's also an accreditation commission. Now, as it happens, we are not independently accredited, but we have access to the materials that would be required should we go for accreditation. So that was also part of the core material that we were working with to develop the coursework that started the program off. So you'll see Susan Kennedy is first graduating class of 1994. It was at the time a really big deal. Our first graduating MSc thesis student might look a little bit different now, but you might recognize him as well. So we wanted the program to always be a starting point. It's not an end point. And so the starting point is that students who go through our program are on their way to be able to do more education and to go for certification. So for example, the Canadian Registration Board of Occupational Hygienists have as an exam that you can either become in training early on in your career, and then as you have more experience in the workplace, to write the exam to become a registered occupational hygienist, ROH. The American Board of Industrial Hygiene, again, has an in-training session as well as final certification as a certified industrial hygienist. And then there's also the Board of Certified Safety Professionals, and they are very much becoming involved in education at this point. So we are very much looking forward to having a closer relationship with that board and the professional exam. They're a certified safety professional. But we've also had a fair number of students, whether they've gone through the practicum route or the thesis route, who have gone on to do PhDs. You're going to meet one of them next term. Harvey was one of our students and is now a researcher in his own right. We've had students who have decided to start their own consultancy businesses. Some of them went on to do an MBA after they finished their degree here. And we've had a handful of students who have gone on to do medical degrees after being in the program.
Okay, so we're gonna have our first Slido question. And if everything goes well, it should, if you're logged in, we should see the question, and anyone can answer this, current students, former students, and those of you who would like to enroll in our degree program, you can also answer the question as well. So what was your main motivation for enrolling in the MSC OEH degree? Or a main key motivation, if you have more than one. Be a hygienist. Yes, you're in the right place. You can kind of see that we've got quite a few of these job opportunities, the co-op and the practicum, training for research experience, practical experience. I'm particularly interested in occupational environmental health research in the area of cancer, helping with already similar path that you're already on, and then someone being safe and healthy in the work environment. So you can certainly see that there are a lot of different motivations, but certainly some key themes that are motivating people currently in the program or for those who have been in the program. So thank you for that, and I think I will pass over to you.
Okay.
Yeah.
So just a few statistics. We can't have data without sharing it. It's just part of our being. But I think it's quite interesting to see that from the beginning of the program, from 1992, already we have had over the years a fairly even mix between men and women entering the program. Now, this is actually a little bit different than the actual historic precedents of hygiene, which, up until a certain point in time, really evolved out of engineering as being the progenitor career. As it became more part of public health, which obviously it does fit very well with public health because it's preventative, is that you see that it became very popular for both genders. And you'll see this when you go to the international meetings as well, that we are, as one cohort, the engineers that kind of slowly become retired and do that sort of thing, we are seeing a much more integrated sample of current practitioners on the field. Now, since 1992, we've had 235 graduates. There's more in the program now, so these are statistics of those who have actually crossed the floor in graduation. The other thing that we're very proud of for this particular program is that we've also had a really nice mix when we look at the mix of ethnic and racial backgrounds in our program. It's always been a strength of the program, and we think that it's our greatest strength actually, because we're then able to move into many different kinds of workplaces with ease because of that shared and unique as well cultural backgrounds from the folks in our program. Okay, sorry.
Yeah.
Now, you'll also see that the graph that I'm showing you here, the pie chart that I'm showing you here, is a little bit dated. And so we would love to bring this up to date. We will be doing this as part of the consultation that we're currently doing. But in general, what we're looking at is a representation of what we have available in British Columbia. A lot of folks do stay in BC. Probably the next biggest group go back to Ontario, because Ontario is a manufacturing hub in Canada. And then we have lots of folks that go back and practice international hygiene, which is really exciting for us. But you'll see that, fair industry, even in British Columbia, which tends to be the extraction industry, has a number of our grads. And what we probably has changed that isn't captured in this particular graphic is that we have a lot more folks that are now in healthcare workers in all of the health authorities now have an amazing representation of our grads, which is really, really neat. But you can see that it's also a growing field for consultants. Many of you have already met Mona Shum, for example, Robert Verdreel. They are folks that came through the program and now have their own consultancies. Okay.
Not yet.
Yes. So we are now past 25 years. We are on the heels of the 30th anniversary of the program. At the 25-year mark, we did have a representation from WorkSafe BC, representation from the university, and celebrating that 25-year mark in the milestones that we have been able to elucidate even then on what our graduates have contributed to the field and have been shaping the field of hygiene as it's currently practiced. Now, I did want to point out that in the very front row is Kate Teschke, and it's very sad that you folks will not have met her. She was she was part of the initiation of the program and an incredible educator. And she is now, I think, still on the board of WorkSafe BC. So hygienists never retire really, they just go on to other ways of being able to contribute to the field, although she has retired from teaching. And I recognize a few other faces in this particular slide as well. Now, preparing for the future.
Thank you very much, Karen. And I think that was a really nice overview of 25 and almost 30 years of our program. And one of the things that our program is doing, and the Occupational Environmental Health Division as a whole is doing, is going through a review and renewal process of the program, but also more broadly the occupational environmental health training and educational needs, not just for students, but also with respect to employers and stakeholders. And part of that was motivated by the COVID-19 pandemic, where we saw a very clear need and an increase in the demand for people with skills in occupational hygiene. I mean, most people now know or have some understanding of how important exposure assessment is, because it's fundamental to ensuring that workplaces and other venues are safe or have a COVID safety plan. And then hygiene in conjunction with epidemiology are kind of two of, I think, some of the fundamental disciplines that have been involved in a COVID-19 response. And so, not just that, but that has been an impetus for us to sort of thinking about, well, what does it mean to think about occupational environmental health in 2030 or 2040, where, at that point we might be looking back over 50 years of training this program. It has been a successful program, but it's also the needs, what we need to be doing, how workplaces have changed, are different than it was in 1992. So with that in mind, in the summer, myself and Karen, I think, as well as a few other folks, Parveen, and also Maddie Geronimo, the lab manager, and Sarah Henderson, as well as Anya Keefe, another adjunct with us, we're working together to develop an alumni survey. And we launched this survey in the summer, and it was to get the graduate perceptions of how well did the program prepare them for what they first did and what they're currently doing now, as well as to get their sense of what are the future, current and future needs. And we're going to share some of those results with you over the next few minutes. So just as a description of the survey, it was sent to all MSC OEH alumni via the UBC Medicine Alumni Listserv, LinkedIn group, and our own MSC email contacts. And it was open for just about 6 to 8 weeks. We had 58 valid responses, which is approximately a 25% response rate. If you recall that 230 odd number of graduates. Better response rate in terms of more recent graduates from 2010 onward versus older graduates that had matriculated in more earlier years. Part of that is just we've lost contact with some of those individuals, and some of them actually are no longer working in the field. A few of them have even retired. 68% of our responses who responded to our gender question were women, and 58% had graduated in the last decade. The survey covered quite a number of domains. What we're going to focus on today is really efficiency of OEH competencies, and talk a little bit about how the program could be improved, as well as advice for current students. So we're going to jump into what those competencies look like. I'm going to turn it over to the clear expert in the room when it comes to occupational environmental health competencies, and it's my colleague Karen.
So for those of you who are currently in first year, and I'm hoping that this is a review for those of you in second year, we have a framework, and the framework is hygienists are studying the recognition of hazards, evaluation of those hazards, control, management of the risk, management of the workplace, leadership in hygiene, and that's part of the graduate gravitas that is brought forward, is very much part of the leadership. A discussion of professionalism, that we are governed by ethics of the profession, and the clear mandate that hygienists are there to protect workers. They do have to work with management, but there is a very clear direction, and that is the protection of workers. Now, we also want to be up to date with occupational and environmental legislation. So I'm just going to throw something in right now, because I only just found out about it yesterday, is that an example of being up to date with occupational environmental legislation, this is a US example, but OSHA, y'all remember OSHA, the Occupational Safety and Health Authority in the States, just came down with a ruling, and this is the United States, I want to put this in perspective. OSHA came down with a ruling that mandates vaccination in the United States to work. If you are not vaccinated in a workplace, you have to undergo weekly rapid antigen testing, and should you test positive, you will be removed from the workplace. They are ahead of Canada, British Columbia, and even UBC on taking a very clear statement of that. And so I gotta say, yeah. But this is the thing, is that occupational health and safety regulations change, and they change on a dime. And so we emphasize as part of the core competency is being able to keep up with changes in the field, and it's a lifelong learning experience. So even those that finish in 18 to 20 months of the program, it's not over yet, right? Is that it's a lifelong process of being able to keep up with the field. And as I often mention, the difference between, one of the differences, even though we use epidemiology as a tool to be able to understand where we want to go with protection and evidence-based practice, is that we have this extra bit in the core competency of hygiene, which is controls. And that is, it's not good enough for us just to recognize, oh, look, there's a hazard. Oh, look, somebody's going to fall off that ladder. We have to go the next step and figure out what the control is going to be so that that worker does not fall off the ladder. And all of these different aspects of hygiene will go all the way from the straight science of being able to interpret properly an SBS sheet, all the way to the creativity and eventually the expertise that we bring to the field to be able to inform policy so that we become part of the process.
Okay, thank you, Karen. Okay, so now to our next slide of question. And this is again open text. We'll try to keep them short if you can. What are some of the specific competencies that fall under these categories? Just type in what you think. We'll give you a few minutes to do that, and we'll a minute or so to do that, and we'll hopefully start to see some of these emerge shortly. Communication skills, very important. Hopefully we're embodying that well today. You tell us later. Measurement methods, teamwork, risk assessments, knowing about occupational exposure limits, exposure, hygiene sampling, leadership, and management systems. Great. Lots of good examples here. Interaction with C-suite decision makers. Interpretation of OHS legislation, critical thinking, great, and continuing education and training. All right, thank you for that. Lots of good answers there. Persuasion techniques, yes, absolutely. And more in respect to communication. Great, so a wide range of that, and thank you for that. And then also maintaining a good balance between workers and management. So I'm going to move on, and we're actually going to go through what specific competencies we measured and consulted with our alumni on over the next couple of slides. So there's a fair bit of information here, and I'll walk you through it. And what we did is we asked our alumni the degree to which they felt at graduation, whether they were very proficient, or not proficient in the following specific competencies that were under those sort of broader domains that Karen just introduced. And so what we're looking at here are those who said that they were proficient or very proficient. Now, done some additional analyses, and I've looked at whether we see differences by gender, as well as by whether you graduated prior to 2010 or after 2010. There are some differences, and I'll highlight a few of those where they do come up. So you'll see that under recognition of hazards, we looked at four different specific competencies, and for the most part, you see the three hazards that are, or the three recognition competencies that are R2 to R4 almost uniformly felt that they were proficient or very proficient at graduation. The one where about a third said that they were not proficient was in recognizing the influence of cultural and social factors in the practice of occupational and environmental health science, and there was a little bit of a variability there with respect to people who had graduated prior to 2010, saying that they had less proficiency in that upon graduation than those that graduated more recently. Now, under evaluation, you can essentially see that we looked at 5 different specific competencies, ranging from selecting and applying appropriate scientific methods, down through to interpreting data, measuring the effectiveness of policies and programs, through to prioritizing hazards and exposures. Now, there was one, and you can sort of see it jumps out, so we put it in red, that there was one competency where only a little over half, 55%, said they felt they were proficient, and that was the measuring and evaluating of effectiveness of policies and programs. So this is like important for information for us as faculty, because we identify all of these competencies as important, and it's good feedback for us to sort of say, what is our program doing well in terms of equipping students, and what is our program not doing well, and that's one of the sort of the key pieces of information that we're looking at in terms of how we chart the future of the program going forward. When we look at control, there are 3 specific control competencies here. Designing and implementing policies, programs, projects, or interventions appropriate, had about 2/3 saying that felt they were proficient or very proficient. Contrast when you look at identifying and selecting the most appropriate control method or evaluating selected control methods, people tended to leave the program feeling that they were quite competent or proficient in that. So you can almost see that if you look at E4 on this and C1 on this particular slide, that there are some similarities. They're tapping into a kind of specific set of ideas there that are more around policies and programs rather than maybe around specific tasks or exposure circumstances. So looking at communication, for the most part, communication, we looked at 3 competencies there. The one where folks felt that there could be, they only about 50% of folks felt that they were proficient or very proficient in designing or delivering adult education programs, including health and safety training. When we look at management, we see all of a sudden a whole bunch of red that jumps out here. And I think that didn't surprise us because we don't necessarily have a specific management or leadership course as yet. We do integrate some of these ideas into some courses. But here you can see thinking about the development of guidelines and policies, thinking about how we sort of manage and allocate resources effectively, or managing staff and personnel effectively. So these are very important capacities that people have to do in the workplace, particularly when they get into more management and supervisory roles. And they're basically saying that at the graduation of from our program, anywhere between 1/3 to 1/2 of them, only about 1/3 to 1/2 of them are feeling that they're proficient in those types of competencies. And that's I think a really interesting finding that ourselves as faculty have had some very good conversations over the last few months or so as we've interpreted or reflected on the survey. And I think part of that is that there is a recognition that we as a program are training people that are very technically competent, they have really good scientific knowledge, but they're also, when they get into the workforce, being placed into management and leadership roles, in some cases quite quickly in their career progression. And that's something that I think that we as a school may need to think about in terms of how we can help support our alumni in being successful in that regard. Similarly with leadership, creating a vision, empowering and fostering collaboration and guiding decision-making. About half of people saying they felt that they were proficient or very proficient. With respect to negotiation and mediation skills, only a third felt that they were proficient or very proficient. And then with respect to building stakeholders and identifying stakeholders and building close coalitions and partnerships, about 40% felt they were proficient or very proficient. When we look at the two final competencies with respect to professionalism, one of the competencies that I think has been emerging more recently, certainly wasn't something that we would have put on the table 30 years ago, but thinking about being sensitive to and applying an equity and diversity and inclusion lens to the practice of OEH. A little over half of our graduates felt that they were able to do that. Interestingly, there was a bit of a difference in terms of when you graduated, where graduates who had graduated in earlier years felt that they had less proficiency upon graduation than graduates that had graduated after 2010. Many of the other professional development competencies, you can see them there on your screen. The vast majority of students are saying that they feel proficient or very proficient upon graduation. With respect to the last two, advocating for policies and programs that will improve OEH outcomes, about 2/3 felt that they were proficient or very proficient. And then this issue of understanding the role and perspectives of union workers and employers, or just a little over half felt they were proficient or very proficient. And finally, when we look at occupational environmental legislation, we see a little bit of a difference there. About 2/3 felt that they were proficient or very proficient in understanding how laws and regulations are enacted, and particularly the role of key players in the process. And that's more about how these things and the why of legislation and regulation. But over 2/3, over 3/4 rather, felt that they could understand and apply relevant laws and regulations. So there's lots there, and certainly we're interested in hearing from you in terms of whether this is your experience, and we as a faculty are using this survey as well as other information that I'll describe later in terms of thinking about how we can respond and adapt to be responsive to the needs that our graduates have when they do enter the workforce. So I'm going to go back to another couple of additional slide of questions. So these now it's going to be a word cloud. So you've got 40 characters here. What competencies or which competencies do you feel most confident in? I think you can answer multiple times. Hopefully I set up the slide in that way, but we'll see what happens here. So we've got 40 characters, so we are looking for like something that's a little bit of a summary of maybe some of those things that were a bit longer. Okay, risk assessment. Big like that means more than one person is doing risk assessment. So it could just be two right now, but still. Exposure assessments, hazard assessment, interpreting WCB or work safety legislation, collaborative work with professionals, exposure assessment, but more than one person saying exposure assessment, more than two people saying risk assessment, presentation skills, critical and analytic thinking, workplace audits. Great, fantastic. Recognition. Great, thank you for that. In the same vein, sorry, I'm gonna move on because usually do have to our eye on the clock here. Which of these competencies do you feel least competent? Again, this is, no one will know who you are if you have the answers. Designing controls. Presentation skills, leadership. Not just using PPE. We're all using PPE these days. Controls. Management. Policy communication. How to advocate for workers, designing of policies. Policy communication. There are 2 people voting on that at least. Data analysis. Let's go for a few more seconds. Hygiene equipment use, great. Okay. Thank you for that. Great stuff, and I'm happy to see that this integration of Slido seems to be working well. So one of the questions that we asked our alumni, and we're currently evaluating, still analyzing this information, was how or what could the program do to improve the teaching of core competencies. I'm just going to provide a couple of examples here to kind of get a flavor of some of the feedback that we heard from our alumni. So in this case, this individual said, allow for the more practical experience when it comes to program development, implementation, such as factoring into the communication program portion. The program does a really good job of training for technical hygiene information. In the real world, a lot of our tasks are more than just sampling. It's program development, training, implementation, communication, and ongoing improvement of those programs and policies. Similarly, another one of our graduates said, allow for more practical experience when it comes to program development and implementation. Oh, this is the same thing. Sorry, I made a mistake. There's another fantastic quote that I want to share with you, but I deleted, when I copied the slide, I deleted it. So just to say that what this individual was going to say was something around management and leadership and training, and they said it very, very well and much better than I ever would. So I apologize to that individual who will remain able to obviously confidential, but in any case, we got some really lovely feedback and very helpful feedback in some of these text comments. So I'm going to ask a question to you. So what could the program do to improve the teaching of core competencies? And this is an open text one, so not a board. Good answer. Leadership courses. Talk more about policy development, worker compensation, business management, diversity and inclusion, especially around Indigenous issues. More practical assessment, more site visits, real world examples of policy implementation. Expand the course requirements. How to integrate OHS into the company's management system, semester work study, industry representatives, data analysis. This is great, thank you. Just let that go a little. Teach students to communicate effectively, shorter, no one reads a 10-page briefing notes. You communicated that very effectively in a few words, thank you. Co-op program, talk about standard OEH documentation. Let this go a little bit for a few more seconds. Thank you for that. And I'll just note that all of these responses, we actually will have a record of them, and so we will actually be able to include this in terms of our data collection, in terms of thinking about what we're doing in terms of program development. So these are great suggestions. Thank you so much. Right. So just to kind of wrap up, one of the things we did ask our graduates, recent graduates, were what type of advice would they give our current graduates, and what would you say are the top 3 challenges in the field of occupational environmental health today? So this individual said stakeholder engagement, understanding and buy-in, hygiene theater, which I'm not entirely sure I understand what that is, but perhaps you know what that is, Sharon. Visible analytics, business intelligence for hygiene program development. In another case, a respondent or a survey respondent said, in terms of OEHS professionals being able to effectively make a change in the workplace, number 1, OHS culture. Many employers and employees do not recognize the ramification of unsafe workplace practices, but choose not to invest into improving working conditions. Recognition compliance. Many employers and employers are not well versed in regulations. And finally, communication. Also too many levels between upper management and frontline staff. So again, lots of good, interesting feedback from our survey. Just a couple of examples of what we heard. I'll just close, and then I think we will have about 10 minutes for discussion and open questions in terms of our next steps. So what we've completed are a number of things. Anya Keith, who I think many of you know, I think she's actually given a couple of talks in the seminar series this semester already, who's an adjunct professor with this school and also an OEHS consultant, has been working with myself and others. And we've done a number of key internal and external consultations in asking many of these questions, additional questions in terms of getting internal and external stakeholder feedback in terms of what they see as their needs and ideas in terms of what we can do, and that's been really, really interesting and informative. There's lots of information there. We've done this alumni survey. We've shared some of those results with you today. And about a month ago, we had a faculty retreat where we really started to sort of grapple with this in a very systematic and formal way ourselves as the Occupational Environmental Health Division here. We have struck essentially 2 groups, something called a curriculum and lab working groups, to start to think about how we can map what we've heard across these various data points and group and consultations to what we're currently doing, and also identifying what we might need to change in terms of resources if we are going to respond. And then we're working on developing a draft forward planning document over the next couple of months. Next, early in 2022, we'll actually be looking at striking community education and external advisory working groups that help advise this process, particularly in those 2 capacities, and thinking about finalizing an OEH strategic plan, which could lead to some modifications and differences in our current courses, potentially some developing some new courses, but also opportunity for additional training and engagement with our key stakeholders. So with that, thank you for your attention. I'm going to turn it back over to Pratik, Angela, and George, and I think we've got a few minutes for questions and discussion. So thank you very much.